Increased staffing needs in the lung cancer screening program. Lung cancer screening is for patients aged 55 to 77 who are at a higher risk of getting lung cancer due to their smoking history. The program is for people who have smoked at least one pack per day for 30 years, half a pack for 60 years, or two packs for 15 years. The criteria is at least a 30-pack year smoking history. If the patient quits smoking, they meet criteria until they have quit for 15 years. Since it is a screening, patients cannot have any symptoms related to cancer, which would include a bloody cough or unintentional weight loss. The issue at hand is the lack of staffing within the low-dose CT lung cancer screening program. Lancaster General Health initiated the lung cancer screening program in 2014. The program was designed to help with early detection of lung cancer in high-risk smokers. It has become a successful program and has brought in over 2,000 participants. The issue with this is as the program has grown, the staffing has not been able to expand. Initially, the program did not require any additional staffing because it was not covered under Centers for Medicare and Medicaid guidelines. In 2015, CMS guidelines included coverage for lung cancer screening, which meant more patients were willing to have it. The program has over tripled its patients since 2015 and completes an average of 10 screenings per day. Nursing job responsibilities include reviewing referrals, placing orders for all lung screenings, annual screenings, 6-month screenings, and initial screenings, scheduling patients, answering patient questions, calling results, and counseling each new lung screening patient. With the increase in patients, especially over the last year, there is an increased need for more nursing support. There are currently 2 part-time nurses working for the program, and the program could benefit from another 2 part-time nurse positions. As of 2018, CMS started covering telehealth services. Due to this, nurses are able to use telehealth to counsel patients who are not directly within their facility. The benefit to this is being able to expand lung cancer screening to other outpatient sites within Lancaster General Health. In order to do this, though, there needs to be more nursing support. A job analysis should be conducted to evaluate future changes for the program. In order to hire more staffing, Human Resources has to approve the need for more staffing. This can be shown by the increase in the number of patients within the last year of the program. It is also shown by the number of patients waiting to enter the program. In order to stay within budget, Human Resources has to pull from another area that is not using the FTE. As the program grows, the money put into the program for things like staffing will be beneficial. The more staff there is to support the growing program, the higher patient satisfaction rates will be, and in return, reimbursement. Job sharing by hiring 2 more nurses will help improve the diversity in the screening program. With smoking cessation, it is important to know how to educate each individual patient to assist with getting them to quit smoking. Having a more diverse staff is important for performance excellence and improved community health. Hiring more nursing staff will help decrease burnout rates for the current nursing staff. In order to improve this issue, Human Resources needs to see the value in hiring 2 more nurses for lung screening. To show the need for increased staff, tracking will be completed for 1 month regarding the amount of time spent in each area, such as phone calls, insurance company issues, and patient questions. The backlog of patients awaiting to schedule will also be supplied. In order for the program to continue to grow, the current patients in the program need to have a positive experience. That way, they tell their family or friends about it. Statistics show that smoking cessation counseling during the shared decision making is more beneficial than during follow-up visits. The expense to train additional staff in smoking cessation can be supported by funding from the National State-Based Tobacco Control Program. Hiring 2 more nurses will have a direct impact on the screening program. It will help with decreased overtime pay due to current employees working over their FTE. Inadequate staffing can result in missed care, which can cost the hospital more money due to reimbursement. More coverage for shifts with job sharing. That means when someone is on vacation, another person will be able to cover more easily with having 2 part-time people hired. Without more staffing support, the current backlog of patients waiting to schedule will only increase. Eventually, physicians will stop referring their patients to the program due to this, and eventually, the program could fail. In conclusion, lung cancer screening has become an important step in preventative care. Continuing this process will benefit the patients and the hospital. The patients benefit from having the option of the screening within their healthcare facility. The hospital benefits from extending its resources to provide the screening for patients. This causes increased patient satisfaction. It brings in more patients to the healthcare system, and it overall increases hospital profits.